Hi, welcome to the course. My name is Fuad, and this video series will help you understand your reading material, assessment, and health professionals education. Now I'll point out to you in this series what's important, what's not so important. So let's go right to it.
Okay, so now we are going to discuss chapter 9, right? Chapter 9, page 141. Performance tests. As you know, if you remember, guys, the pyramid. Okay, we have discussed these two levels: assessment of the nose and the nose how. What about this one? Oh, this one is the shows how. Why is it called shows how? Because there's this element, as mentioned in the book, the performance. Well, now you're going into performance. You have elements of skill, or what we call as, psychomotor. And the situation is contrived, meaning that we set it up, we control the environment, we simulate things, we call the candidates to a hall, we call patients who are trained to respond, or we call normal people who simulates a patient. It's very much like a test tube situation, an experiment, scientific experiment where the situation is controlled. Therefore, the assessment of a shows how is called as an in vitro assessment. Okay, we very much control the situation, the surroundings of the assessment, so that it becomes very standardized. So this is the assessment at this level. As you can imagine, we are going up the pyramid, and we're at this stage, at the shows how stage. They are more senior now, they know, and they know how they can apply. But now we are looking the integration of knowledge plus skills, but at a level which is still controlled. That is the assessment of the shows how level, and this is usually called the assessment performance tests. Right, as of any discussions before this, we start off the discussion after defining the after introducing the area of assessment. We go on to its strengths and limitations, advantages and limitations. So in assessment of the shows how performance tests, as we have discussed before, we can control the examination situation, the assessment situation. So it's to control one of it, right? Control of the assessment, and this includes standardization. We standardize what kind standardization. What kind of patient the candidate meets, we train the patient, and so on and so forth. All right. Things like training, we train the examiners. Okay, and in terms of sampling, we systematically sample the competencies that we want from the candidates, and of course this leads to a better feedback for candidates, as well as we can give coaching and debriefing for them. All this is explained further elaborated in the book, so you should go and read just this section. And last but not least is that we can make sure all candidates have reached a minimal level of competency before they go on to the next level. Okay, so these are some of the strengths of performance tests. What about limitations? As discussed in the book. Alright, let's get to limitations. A few of the limitations I've mentioned, but I think the most significant one of all is the logistical. As we will see later, it is quite complicated to run, and it is one of the most significant limitations that we can find in the assessment in this area. Okay, other limitations are such as the realism of the simulations that we do during these typical assessments, and related to that, the more realistic we want things to be, usually the more expensive they are, right? But it need not be like that, but usually it is. And I think these two are the most significant limitations of performance assessments: logistical demands, as well as the expense issue. Okay. Right. So as usual, we have to know what the assessment is best used for each type of assessment method. So for performance examinations, it is suggested in this section, defining the purpose of the test, page 142. All right. So here it is suggested that for performance assessments, because as we have discussed before, they are so because they are quite costly. Okay, that's one of their drawbacks, right? So this assessment is best reserved for assessment or for assessment of skills that cannot be observed or assessed effectively elsewhere or by other means. Okay, skills which can't be assessed elsewhere better. assessed elsewhere. Now it's mentioned that things like interactions with patients, communication, interpersonal skills, data gathering by history of physical examination, clinical reasoning, decision making, documentation in the patient chart. Now that's quite rarely tested in my experience. Ethical and professional behavior and procedural skills, procedures, right, can all be elicited and assessed effectively in simulated settings. Now it discusses that we can have a choice in the assessment, performance assessment, what level do we focus on? Okay, individual skills or complete clinical encounter. For example, if it is early in training, let's say first year, they've just learned the basics of examination skills, for example. Okay, so we might choose to assess just, for example, examination of the knee, so that's not the knee, the elbow joint. Just focus on examination of the elbow joint, or examination of the ears using a tuning fork, or examination of the knee joint. Just focus on individual skills. Okay, and it is mentioned if when you go later, intermediate stage, maybe a bit more senior, then you can focus on something a bit more complicated, such as taking history from patient complaint of in acute abdomen. Or examination where the patient then afterwards asking them the differential diagnosis and management and things like that. So you can use this type of assessments for an intermediate stage, and at the advanced learner stage we still can use performance assessments to assess something in which complex situations. Like breaking bad news, and things like that. Okay, so this is where the performance assessment, remember the definition, where we simulate a clinical encounter, we control the situation, and this is where they are best used. And the final note in this section is worth noting here, that a performance test does not require the subsequent oral examination or discussion of the patient. The encounter itself is the object of the rating. We focus on the encounter itself. Okay, we focus on the encounter itself. Later on, discussion of the encounter that is best done in paper-based assessment, for example. What else? This is always an issue, or this is discussed in long cases. Okay, long cases, we ask the candidate to meet a patient, take a history, clerk a patient, examine, then present. So, and often the interviewing, the history taking, the examination during the long case, the initial part is not observed at all, not assessed at all. We do not see how they take the history, we do not see how they ask questions. We just discuss with the candidates the product of the history taking. So here it is noted that we are focusing on the encounter and we are not bothered with the second part, which is usually found in a long case. So a performance assessment focuses on the encounter itself. Okay, thanks. Alright, standardized patients. Now, standardized patients are discussed in this section because often we use standardized patients in performance examinations. In OSCEs, for example, they are extensively used in OSCEs. So if you can remember, a patient is sometimes involved in involved in long cases, because OSCEs actually evolved as a direct or indirect complaint against long cases. Because if you remember, in long cases, in a long case, a student comes and clerks the patient, okay, takes the history, examines, and this is a real patient. This is a untrained, unstandardized patient. And one student comes, and then another student comes, not necessarily together, they come in sequence, but the story that this patient gives for the first students may be different from the second, may be different from the third, depending on this patient's mood, his emotions, maybe he's tired or whatever. Okay, so it becomes unstandardized. And therefore we have lost the element of comparability. Okay, that is why the thought comes that we will train this patient and train them to respond, to tell the history, or to respond in an examination in a, like mentioned in the book, in a consistent and believable manner. Okay, in a consistent and believable manner. It's not that they are just like a recording that they will tell all students in a memorized sentence in the same way. No, they are also trained to respond to students. If students ask in this way, you will tell them this. If students ask you this, you will tell them this. So they will each student will get different results depending on the way in which they interact with the standardized patients. However, 2 or 3 students asking the patient and the standardized patients in the same way, in the same conduct, they will receive the same response. So this is what we want. This is why we call them standardized patients. Consistent, believable manner. and initially it's just for history taking. However, as mentioned in the book, there are now what we call as hybrid or multimodal simulations, where there might be an SP there, okay, simulating meaning pretending, for example, an accident victim, and the candidate is asked to perform a toilet and suturing, and when he does that, he does it in a simulator, maybe artificial skin, but the skin is put on the patient's arm, so that the patient, the standardized patient, can interact appropriately, maybe can show anxiety, can show pain and things like that. So that's a hybrid or multimodal simulations. And standardized patients now have expanded their role into training of lecturers in faculty development activities, and such, and so they have this term of standardized students, standardized family members, standardized colleagues. This is for training situation. Okay, very interesting, isn't it? Okay, and the chapter or this section goes on to discuss what are the things that you need to train standardized patients, and it talks about scripts, SP scripts, what is there in a script and what are the other things is nicely summarized in box 9.1. Box 9.1, page 144. You can see all the paraphernalia and the preparation that we need for utilizing a standardized patient case. They call it, what are the elements? You need a general case information, case summary, and SP training notes, additional materials, a lot of things, yeah, if you are serious about using SPs in your examination.